This video will illustrate for you a step-by-step process about how to administer your enteral formula as a bolus through your tube using a gravity bag. Note, the products that are seen in this video may differ slightly in terms of color or size than what you receive at home. The feeding tube that you have may also differ from what you see in this video. Your clinician will demonstrate all of your supplies during your first few visits. If you ever have any questions regarding this video or your supplies, contact your pharmacy. The number is located in your patient packet that you received with your first delivery. Feeding tubes are used to allow you to get nutrition that you need from liquid, blenderized food, or formula directly into your stomach or intestine. Tubes will reach your stomach or intestine through your nasal passage or abdomen. The bolus via gravity bag method is used to give yourself a set amount of formula over a short amount of time through a gravity bag. Gravity bag feeding allows you to control the rate that formula flows through your tube and allows you to be hands-free during the process. Step 1. Gather your supplies. First, you will want to clean a surface with soap and water or a disinfectant wipe. This is where you will place your supplies. Now, grab the gravity bag, IV pole, formula as prescribed by your doctor, syringe, cup of room temperature water, and clean towel or paper towel and tube feeding guide. Do not warm your formula in the microwave. You should store your formula at room temperature. Look at the expiration date. Also, make sure that you are sitting upright or have your head elevated to 30 degrees or more if you are unable to sit upright during your feeding and for at least 30 minutes after your feeding. Step 2. Hand washing. You will not need to wear gloves for this procedure. You will wash your hands thoroughly for at least 20 seconds. Using soap and water or a disinfecting alcohol-based hand sanitizer if you do not have access to soap and water. When you finish washing your hands, you will dry them with either a paper towel or a clean hand towel that is used only for this one time. Use the towel to turn off the faucet. This is a clean procedure, not a sterile procedure, and should mimic what you would do before you sit down to eat dinner. Step 3. Flushing. Flushing is the #1 way to prevent your tube from clogging. It's important to flush before and after you put anything down your tube, which includes medications and formula to help keep your tube clean. Grab the cup full of room temperature water and syringe. Put the syringe in the water and pull back on the plunger to fill the syringe to the amount prescribed by your doctor. Usually this amount is between 30 to 120 milliliters, but call us to confirm the amount if you are unsure. After you have the syringe full with the prescribed amount of water, make sure to clamp your tube before you open the port. Once the port is open, hook the syringe up, unclamp the tube, and slowly push or flush the water through the tube. When you are finished flushing your tube, remove the syringe and close the port. Step 4. Administering your formula. Your formula should be at room temperature before used. First, shake the formula container well. Remove the formula container lid. Next, make sure the roller clamp on the gravity bag is closed or all the way in the downward position. Then pour the prescribed amount of formula into the gravity bag. You may also add water to the formula if recommended by your doctor at this time. Now you can close the lid and hang the gravity bag on the IV pole. Step 5. Priming the tubing. Now you will take the plastic cap off the tip of the gravity bag tubing. Hold the tip of the tubing over the sink, formula container, or trash can. Next, you will want to get air out of the tubing by slowly opening the roller clamp, by pushing upward on the roller clamp, and allowing the formula to reach the end of the gravity feeding set. Once formula reaches the tip of the feeding set, close the roller clamp again by pushing the roller clamp all the way in the downward position. Now you are ready to administer your formula. Open the feeding tube port. Don't forget to clamp your tube before accessing your port. Unclamp the feeding tube. Next, connect the feeding set to your feeding tube port. At this time, slowly open the feeding set by pushing the roller clamp upward to where it sits in the middle. Most patients administer 8 ounces of formula via gravity bag within 20 to 30 minutes. Depending on how you feel, to speed up the flow, open the roller clamp by pushing upward. If you'd like to slow down the flow, push the roller clamp downward. Step 7, final flush. At this time, you will flush your tube again with the prescribed amount of room temperature water, using the same exact instructions as you did the first time you flushed your tube before administering the formula. Think of a water sandwich. Flush before and after you put anything into your tube with room temperature water. Step 8, cleaning your equipment. Finally, you can clean up your tube feeding supplies and throw away empty containers. You will need to reuse the same gravity bag for 24 hours. Be sure to rinse your gravity bag set out by opening up the roller clamp and running warm water through it. It's important to not use dish soap in your gravity bag. Let it air dry until your next feeding. After 24 hours, discard the gravity bag into the trash or recycling bin per directions from the manufacturer. You are also able to reuse your syringe. Just make sure to hand wash it with dish soap and warm water and air dry it on a clean towel or paper towel. Typically, you can reuse your syringe for 1 to 2 weeks or until the plunger wears out. If there is unused formula left over, you may cover it and refrigerate it up to 24 hours. Be sure to let the formula warm to room temperature before administering it in the future. Discard empty containers in the trash or recycling bin per directions on the container. Congratulations, you are now finished with your tube feeding using the Bolus through a gravity bag method. Emerita is available to help any time of day, any day of week. Do not hesitate to call your local Emerita pharmacy with questions or concerns. This contact information is in your folder. You will also find resources on our website available to you at www.emeritaiv.com. We look forward to the opportunity to serve you.